Hey everyone! Welcome back to Speak Easy English. I'm Luna.
And I'm Henry. If this is your first time here, we're really happy you joined us today.
In this podcast, we help you learn simple, real English for daily life in North America.
Yes, the kind of English you actually hear at stores, offices, clinics, and many other places.
Today's topic is something many newcomers experience sooner or later, a medical checkup.
Yep, a simple health check. Nothing scary, but if your English is new, it can feel a little stressful.
Oh yes, I remember my first health check in the United States. I was sitting in the waiting room thinking, what if they ask me something I don't understand?
That feeling is very common. Many people worry about the language more than the checkup itself.
Exactly. The nurse called my name and my heart went thump, thump. I stood up and thought, okay, Luna, just breathe.
But the good news is, most medical checkups use very simple English.
And the staff are usually very patient.
Today, we'll walk through the whole experience step by step.
From the moment you arrive at the clinic,
To measuring your height and weight,
checking your blood pressure,
and even getting a blood test.
blood tests are very common in the US.
Yes, doctors often order blood tests to check your health.
Many people go to labs like Quest Diagnostics.
Or LabCorp. These labs are very common across the United States.
You usually go there after your doctor gives you a lab order.
They take a small sample of blood and send it to the lab for testing.
Don't worry though, the whole thing usually takes only a few minutes.
And the staff do this all day, every day.
In Canada, it's very similar too.
Right. Different names sometimes, but the process is almost the same.
So, today we will practice the kind of English you might hear during a checkup.
Short sentences, simple words, real conversations.
And we'll go slowly so you can follow along.
You can also repeat the sentences with us if you want.
Imagine you are walking into the clinic with us.
Maybe you are holding your ID in your hand,
Maybe your appointment is in 10 minutes.
and you're looking around thinking, okay, where do I go first?
Don't worry, we'll go through it together.
In the next part, we arrive at the clinic and check in at the front desk.
All right, so now let's imagine something new. You are standing outside a clinic in the United States.
Maybe it's a small neighborhood clinic, or maybe it's an urgent care center.
You look at the door, take a small breath, and then you walk inside.
The first thing you usually see is the front desk.
Yes, the check-in desk. There is usually a receptionist sitting there.
Sometimes there are a few chairs in the waiting area too.
Maybe a TV on the wall, maybe some magazines on a table.
And maybe a quiet printer going whir whir behind the desk.
When it's your turn, you walk up to the desk.
The receptionist usually smiles and asks a simple question. Hello, how can I help you today?
Hi, I have an appointment.
Great. What time is your appointment?
10:30 this morning.
Perfect. May I see your ID and your insurance card?
Sure, here they are.
Thank you. One moment, please.
You might hear some typing on the computer.
Tap, tap, tap on the keyboard.
Then the printer starts again. Whir, click.
After that, the receptionist may give you a form. Please fill out this form.
Okay, do I need to fill out everything?
Yes, please fill out the medical history section too.
All right.
The form usually asks simple questions.
For example, your name,
Your address,
your phone number.
and sometimes emergency contact information,
You might also see questions about allergies.
or medicines you take.
Don't worry if the form looks long.
Most of the questions are very simple.
When you finish writing, you bring the paper back to the desk.
Something like this.
Hi, I finished the form.
Great, thank you.
Do I need to wait now?
Yes, please have a seat. The nurse will call your name soon.
Okay, thank you.
Then you go sit in the waiting area.
Maybe you check your phone,
Maybe you look around the room.
and sometimes you hear a door open.
Then a nurse appears and calls a name. Luna?
Yes, that's me.
Great, please come with me.
And that's when the next part of the checkup begins.
In the next section, we'll see what happens when the nurse measures your height and weight.
So now you follow the nurse down a short hallway.
The hallway might be quiet, maybe a little bright, with white lights on the ceiling.
You might hear soft footsteps on the floor.
Step, step, step.
Then the nurse opens a small room.
This room is usually called an exam room.
Inside, there is a chair, a desk, and some medical equipment.
One very common thing you will see is a scale.
Yes, the scale is for measuring your weight.
And next to it, there is often a tall measuring bar for height.
The nurse usually starts with something simple.
All right, let's check your height and weight.
Okay.
First, please take off your shoes.
Oh, okay.
This is very common in clinics.
Shoes can add a little extra height.
And sometimes a little extra weight, too.
After you take off your shoes, the nurse points to the scale.
Please step on the scale.
You step up carefully.
The scale might make a small sound. Beep.
Then the nurse looks at the numbers.
All right. Please stand still.
Okay.
Good.
After checking your weight, the nurse measures your height.
Please stand straight against the wall.
Like this?
Yes, that's perfect.
The nurse moves the measuring bar slowly.
Click.
It gently touches the top of your head.
Try to look forward.
Okay.
Great.
The nurse checks the height number.
All right. Your height is 5'6".
Oh, okay.
And your weight is 140 pounds.
Good to know.
Sometimes the nurse writes the numbers down.
Or enters them into a computer.
Tap, tap, tap on the keyboard.
Many people feel nervous during medical visits.
But this part is very easy.
Yes, measuring height and weight only takes a minute.
After that, the nurse usually continues with the next step.
Often it is checking your blood pressure.
Blood pressure is very important for your health.
The nurse may ask you to sit down first.
And relax your arm.
That part can feel a little strange the first time.
But don't worry. We'll explain it together in the next section.
After the nurse checks your height and weight, the next step is usually very common in clinics.
Yes, this is when they check your blood pressure.
Many people have seen this before, but it can still feel a little strange the first time.
The nurse may ask you to sit down in the chair.
Please have a seat.
Okay.
The nurse rolls a small machine closer to you.
This machine measures your blood pressure.
It has a soft band called a cuff.
The cuff wraps around your upper arm.
The nurse might say something like this.
Please relax your arm.
Okay.
Try not to move.
The nurse gently wraps the cuff around your arm.
Then the machine starts working. Pump, pump, pump.
The cuff slowly gets tighter.
It can feel a little strange,
Maybe a little squeeze.
but it only lasts a few seconds.
The nurse might say something to help you relax.
Just breathe normally.
Okay.
Then the machine makes a small sound.
Beep. That means the measurement is finished.
The cuff slowly loosens.
Ah, that feels better.
The nurse checks the numbers on the screen.
Many people are curious about the result.
So sometimes patients ask a question.
Is my blood pressure okay?
The nurse might respond like this. Yes, it looks good.
Oh, great.
Or sometimes they say something a little different. It's a little high today.
But don't worry.
Blood pressure can change during the day.
Stress, coffee, and even walking can change it.
After that, the nurse often checks your temperature.
Temperature checks are very quick.
The nurse may hold a small digital thermometer.
Sometimes it goes under your tongue.
Sometimes it touches your forehead.
The nurse might say something simple.
Please open your mouth.
Okay.
Or maybe this. Please hold still.
The thermometer makes a tiny sound. Beep, beep. That means the reading is ready.
The nurse looks at the number.
Your temperature looks normal.
Good.
These small checks help the doctor understand your health.
Height, weight, blood pressure, and temperature are called vital signs.
Doctors check these almost every visit.
And the whole process usually takes only a few minutes.
After that, the doctor may come in to talk with you.
Sometimes the doctor also orders a blood test. In the next section, we'll talk about how doctors explain blood tests.
After the nurse finishes checking your vital signs, you usually wait in the exam room for a few minutes.
Sometimes the room is very quiet.
Maybe you hear a faint sound in the hallway,
Footsteps walking by.
or a distant phone ringing.
Ring, ring.
Then suddenly, there is a small knock on the door.
Knock, knock.
The doctor walks in and smiles.
Hello, how are you today?
I'm good, thank you.
That is a very common way to begin a doctor visit.
The doctor might sit down and look at your chart.
Sometimes they type something into the computer. Tap, tap, tap.
Then the doctor asks a simple question.
What brings you in today?
This means the doctor wants to know why you came to the clinic.
Maybe you came for a routine checkup.
In that case, you can say something simple. I'm here for a checkup.
The doctor might ask a few basic health questions.
For example, how have you been feeling recently?
Have you had any pain?
Are you taking any medications?
These questions help the doctor understand your health.
After talking for a few minutes, the doctor might mention a blood test.
Blood tests are very common in the United States.
The doctor may explain it in a very simple way.
I'd like to order a blood test.
Oh, okay.
It will help us check your health.
Many patients feel a little nervous when they hear the words blood test.
But the doctor usually explains that it is quick. We will take a small blood sample.
That means they only take a tiny amount of blood.
Usually from your arm.
The doctor might also ask another important question.
Have you eaten today?
Some blood tests require fasting.
Fasting means you do not eat for several hours before the test.
Sometimes 8 hours.
Sometimes 12 hours.
If you already ate, the doctor may schedule the test for another day.
If you have not eaten yet, you might be able to do the test the same day.
The doctor may explain where to go.
You can go to Quest Diagnostics
Or LabCorp.
These labs specialize in blood testing.
The doctor might give you a paper order.
This paper tells the lab which tests to perform.
Sometimes the order is sent electronically.
Then the lab already has the information.
Many patients ask one simple question. Will it hurt?
The doctor often smiles and answers honestly. You may feel a small pinch,
Just a tiny poke from the needle.
and the whole process usually takes only a few minutes.
After that, the lab sends the results to your doctor.
And in the next part, we will visit the lab and see how a blood test actually happens.
After your doctor orders the blood test, the next step is visiting the lab.
In the United States, many people go to places like Quest Diagnostics.
Or LabCorp.
These labs specialize in collecting blood samples.
Usually the clinic gives you a lab order first.
Then you bring that order to the lab.
Sometimes you make an appointment online.
Sometimes you can just walk in.
Let's imagine you walk into a Quest Diagnostics location.
The room might look a little like a small office,
There is usually a front desk,
and a waiting area with chairs,
maybe a quiet TV on the wall.
or a small sign telling patients to check in.
When you reach the desk, the staff member greets you.
Hello, do you have a lab order?
Yes, I do.
May I see your ID, please?
Sure, here it is.
Thank you.
The staff checks your information in the computer.
Tap, tap, tap on the keyboard.
Then they might ask you to sit down and wait.
Please have a seat. We will call your name soon.
Okay.
After a few minutes, a technician appears. Luna,
Yes?
please come with me.
You follow the technician into a small lab room.
The room usually has a chair and a small table.
There are also tubes and medical supplies.
The technician explains the process. We will take a small blood sample.
Okay.
Please roll up your sleeve.
You roll up your sleeve so your arm is visible.
The technician looks for a good vein.
Sometimes they gently touch your arm.
Then they clean the skin with alcohol.
The cotton pad feels cool.
Next comes the small needle.
Many people feel nervous at this moment.
The technician usually gives a little warning. You may feel a small pinch.
Okay.
Then the needle goes in very quickly. Tiny poke.
Some people say it feels like a quick pinch.
The blood flows into small tubes.
The technician changes tubes quickly.
Click.
The whole process usually takes less than a minute.
After that, the needle comes out. All done.
The technician places a cotton pad on your arm.
Please press here for a minute.
Okay.
In the next part, we'll talk about what happens right after the blood test.
After the needle comes out, the technician places a small cotton pad on your arm.
The cotton pad helps stop the bleeding.
The technician usually gives you a simple instruction.
Please press here for a minute.
Okay.
You press the cotton gently against your arm.
Some people look at their arm carefully.
Others prefer not to look at all.
That is very normal.
Everyone reacts a little differently to needles.
After a short moment, the technician checks the spot again.
Let me see.
The bleeding is usually already stopped.
Good.
Then the technician places a small bandage on your arm.
This bandage is often called a Band-Aid.
The technician might say something simple.
Please keep this on for a few hours.
Okay.
Some people feel a little lightheaded after a blood test.
Lightheaded means you feel a little dizzy.
It does not happen to everyone.
But the technician may still ask you a question.
Are you feeling okay?
Yes, I'm fine.
That's great.
If someone feels dizzy, the technician may ask them to sit for a moment.
Please sit down for a minute.
Taking a short rest can help your body recover.
The technician might also give you some advice. Drink some water today.
Water helps your body recover after the test.
They might also say something else. Avoid heavy exercise for a few hours.
This helps prevent bleeding at the needle spot.
Most people feel completely normal after a few minutes.
And the whole visit at the lab is usually very quick.
Many patients are surprised how fast it is.
The technician may throw away the used materials safely.
You might hear a small container close. Click.
Then the technician gives you one final instruction.
You're all set.
Thank you.
You're welcome. Have a great day.
After that, you can leave the lab.
The blood samples are sent to the laboratory for testing.
Scientists and machines analyze the blood.
They check things like cholesterol, sugar levels, and other health markers.
But patients usually do not get the results immediately.
In the next section, we'll talk about how you receive your test results.
After your blood sample is taken, the tubes go to the laboratory for testing.
Inside the lab, machines and technicians analyze the blood.
They check many different things.
For example, cholesterol levels,
Blood sugar levels.
and other markers that show how your body is working.
But patients usually do not receive the results right away.
The testing process takes some time,
Often 1 or 2 days.
sometimes a little longer.
Many clinics now use something called a patient portal.
A patient portal is a secure website or app.
You can log in and see your medical information.
Some people receive a message when the results are ready,
For example, a notification on your phone.
or an email telling you to check the portal.
When you open the portal, you may see a list of test results.
Each test usually has a number.
Next to the number, you may see a normal range.
The normal range shows what doctors consider healthy.
If your number is inside that range, it usually means everything is normal.
Some results may have a small note beside them,
For example, normal.
or slightly high.
Sometimes patients feel worried when they see numbers.
That is very common.
But it is important to wait for your doctor to review the results.
Doctors understand the full medical picture.
Sometimes the clinic calls you directly.
Hello, this is the clinic calling about your test results.
Many people feel nervous when they receive a call like this.
But often the message is very simple. Your results look normal.
Oh, that's great to hear.
Or the doctor might say something else. Everything looks good.
In some cases, the doctor may want to discuss something.
If that happens, they may schedule another appointment.
But most routine blood tests come back normal.
And many patients feel relieved when they hear the results.
Medical checkups are an important part of staying healthy.
They help doctors find small problems early.
And they help patients understand their health better.
In our final section, we'll review the key English phrases from today's visit.
Today, we walked through a full medical checkup in the United States.
Yes, step by step, from arriving at the clinic to getting your blood test results.
For many newcomers, medical visits can feel a little confusing at first.
The building is new,
The process is unfamiliar.
and the English can feel difficult.
But the good news is that medical English is usually very simple.
Doctors and nurses often use short and clear sentences.
Now let's practice some useful phrases together.
You can listen first or repeat after us.
Imagine you arrive at the clinic.
The receptionist asks a question. How can I help you today?
You can answer like this. I have an appointment.
Or another common sentence. I'm here for a checkup.
After that, the nurse may measure your height and weight.
Let's practice those instructions.
Please step on the scale.
Please take off your shoes.
Stand straight.
Look forward.
Next, the nurse checks your blood pressure.
You might hear this. Please relax your arm.
Try not to move.
Just breathe normally.
Then the doctor may talk about a blood test.
Let's practice those phrases.
We will take a small blood sample.
You may feel a small pinch.
It will only take a minute.
At the lab, the technician gives simple instructions.
Please roll up your sleeve.
Please press here for a minute.
After the test, you wait for the results.
Hopefully, you hear something like this. Your results look normal.
Everything looks good.
Great job practicing these sentences today.
Remember, you don't need perfect English at the doctor's office.
Simple sentences are enough.
Doctors and nurses help people from many countries every day.
They understand that English may not be your first language.
The most important thing is your health.
Thank you for learning with us today. We'll see you next time on Speak Easy English.